Compassionate communication, I believe, very much reduces stress, it reduces hierarchies within a workplace, it reduces a feeling of isolation with individuals, and it really helps gain insight and appreciation and understanding of other people. Compassionate communication is very important to make sure that you're understanding what your client is thinking, exploring what their needs and expectations are, and to be able to give compassionate care and compassionate communication. Veterinary surgeons need to be valued in terms of themselves as well. So everybody in the veterinary team needs to be valued so that they can provide compassionate care and compassionate communication. Compassionate communication is very important for delivering good patient outcomes, and it makes all the difference in a patient's experience of that care, and in the veterinary professions, the owner's experience of that care. So that really then plays into what the owner's expectations are of that particular care. And for a veterinary professional to be able to provide that compassionate care and compassionate communication, they need to be supported and valued in their job. So that's a very important part of the compassionate care, compassionate communication. Well, I think, first of all, if we look at the traditional model of communication, so pare it right down to what communication is. And it's about the giver of an information or a message, so a giver, and they are giving a message or a communication or information to a recipient or recipients. And within that, the giver and the recipient, there's the context of where that takes place and the environment. And compassionate communication is really about looking at those individual components, shining a spotlight on those, and trying to make each component as absolutely best as it can be to get the best outcomes. So if we look at the giver, for example, for the first instance, in terms of what the information or the message that the giver wants to impart, it's really important for that giver to think about the message. So the message comprises of the words that's used, the bits of information. It also comprises the tone of how that delivery is made, so the cadence, the speed, the tone of that communication, and then also body language. And then thinking about those three components, what's very surprising is that only 7% of the message is about the words. So the words can be incredibly well crafted, they can be well, articulated well, really clear, but if the words don't match the tone, so if the tone is maybe too fast, it's not articulated well, 38% of the message is about the tone, and an astounding more than 50%, so 55% of the message is body language. So unless those three are aligned, then it doesn't matter how good, how credible, how well crafted those words are. If the other two aren't aligned and resonate, then the words are lost. And if I can maybe just give you a very short story of when I was in practice. I was early days in practice, and I was reversing. I'd done a farm call and I was reversing out of the yard, and I reversed into a low wall, damaged the practice car. So I went back to my employer. And I was genuinely remorseful that I had backed off into this wall and damaged the back of the car. So my words were of, apology, I'm very sorry about the car, but I was so nervous that I smiled. So all he saw was the smile, and it didn't matter how apologetic I was. It was the smile that he saw, and he was very, very angry with me because he thought I was making light of it. So that just shows you as an example of how important it is that the words match the tone, match the body language. And I think specifically for veterinary professionals, remember that if you're on the phone, you've lost 55% of the power of that message because you're not being seen, you're only being heard, and you've got the words. So really important to think about your tone more so when you're doing a communication over a phone. So the next thing to think about in compassionate communication is being authentic, because I think that's the core of being a good compassionate communicator. Be authentic, be engaged, not distracted. And then thinking about the context, think about the environment. So if you're wanting to have a compassionate communication episode which might be challenging, thinking about the environment, making sure it's a safe space, it's neutral, there's no distractions, so that you can properly engage and listen to the person that you're communicating with. So, for example, it could be a client, it could be a colleague. And then turning to listening, Really, it's about listening to understand. It's not about listening to respond, because if you're listening to somebody and thinking about what you're going to say next, you're not listening to what they're saying. So really important to listen, to understand, and not to respond. So in terms of listening, it needs to be active listening as well. And what active listening means, as well as listening not to respond, but to understand, it means about maybe it's about building rapport, building trust, and you do that by being still, being engaged, showing that you're engaged. You maybe want to mirror some of their body language, so that again just builds rapport. And then you can really build a really decent space. So the physical safe space is safe, but also the psychological space is safe as well. And then it's a question of really listening to them to understand and identify what their concerns are, but also what their expectations are. And I'll touch on contextualised care at a later point. But it's really understanding, exploring, being curious, not jumping to make any assumptions, not being judgmental, really just listening. It's their experience. You need to know what they're thinking. Then it's a question of thinking out a plan. What's going to happen as a result of this? How are you going to explain what's happening, explaining it in their words so that they can understand, and providing advice, again, in language that they can understand, and then signposting for next steps or maybe other advice. For example, you could maybe give them a leaflet as well as explaining, a leaflet backing up what you've said, so that when they have left the consulting room, they've got something to refer to, because they might not have remembered it all. And then also saying that they can always phone the surgery if they would like a reminder about any of the steps that have been discussed. I think the challenges are multiple and varied, and they're not just within the veterinary sector. They're actually, national, international challenges. And I think the one saying that's so true is that the only thing that's certain is change. And I think the pace of change is actually accelerating as well. So there's a lot of pressure on staff in all sectors, but specifically in the veterinary sector, we've currently got the Competitions and Markets Authority investigation. And as I said, I volunteer for VetLife, and there were definitely more calls around that. Vets and veterinary teams, veterinary nurses and other staff are worried about the authority investigation and what the outcomes might be. And that when it was first announced, there was a lot of kind of quite negative media that was directed towards the veterinary professions, which didn't help. We've got the cost of living crisis. So vets are saying maybe more pets are being relinquished. Potentially pets are not being taken to the vet maybe as soon as they should be. And possibly, again, lack of compliance with treatments because of the cost of living. Again, more calls came into VetLife with the XL bully ban earlier this year, and vets being really concerned about having to euthanize animals that were healthy because of the legislation. And again, more calls came into VetLife on the back of that. We've also got the threat of redundancies. So there have been a lot of redundancies announced recently. So there's job insecurity that people are worried about, financial insecurity. And again, that has come through in VetLife calls. And we've got inappropriate, unethical breeding. So vets are being presented with dogs and actually now cats that they might, it's actually quite an ethical dilemma, because they know that these animals have been bred not with the best of intentions for their health and welfare. So there's many and varied, and they will change over time. But I think there's a lot of pressure on individual veterinary professionals, but also within practices as well, because we have got an ongoing workforce retention issue. So a lot of practices are running that are not properly 100% staffed. So the staff that are in the practices are being stretched more than they would normally be. And again, this is a global challenge, but climate change and global warming. So we're seeing an increasing number of vector-borne diseases that are now those vectors can survive or maybe even establish in the UK. And from my own, going with my own background, the increasing incidence of blue tongue virus cases in the UK. So not only in the southeast of England, where there was a lot of work to prepare for that, infected midges being blown over the channel from the north of Europe, but they're actually being found much further north in England as well, which is a concern, not only for the livestock vets, but for the farmers and for trade. So interesting question. There's much more pressure on veterinary practices as a result of all of those pressures, external to the veterinary profession, but also internal to the veterinary profession as well. So much more pressure, time pressure, pressure to deliver, maybe sometimes shorter times for consultations, and they've got to do all of this within a set time frame. So some practices have got quite short consultation times. So a lot of pressure on vets to deliver within constraints, and I mentioned the workforce crisis as well, and poor retention, so often running in under resourced practices. So a lot of pressure from there. Tempers can get frayed in consultation rooms. I think there's increasing client expectations of what they expect in terms of care for their animals. They will often look online what could happen, or be on social media. We'll hear things as well. So there's a lot of extra pressure on vets, and as a result of those things, I believe there's more cases of clients coming in. They're maybe frustrated, they're worried. They have their own external pressures, and then they put that onto the veterinary professionals and people within the veterinary team. And I'm talking about incivility, and incivility is a whole spectrum of actions and behaviours, if you like. So incivility can be what can be deemed as quite innocuous rolling of the eye, but actually that is incivility. It could be rude, aggressive language, right through to being very confrontational at reception or anywhere within the veterinary practice. And the consequence of incivility, whether you are a recipient of incivility or even you just witness incivility, is a negative impact on your own mental health and well-being. And there's research to show from the medical profession that incivility actually has a negative impact, an adverse impact on patient outcomes as well. So you can just see that sort of the perfect storm of all of these different pressures being brought into the consulting room and ultimately potentially impacting on patient outcomes. So I'd just like to refer back to an earlier comment I made, that the compassion shown by staff makes a huge difference on the patient's and the owner's experience of the care experienced. And I think I would refer back to the previous conversation about communication models, and traditionally it was very hierarchical. So as a vet, we're the ones with and the vet nurse, we're the ones with the knowledge and the expertise. We're giving to a client, an assumed layperson, and it's like a one-way traffic of information. And I think that is a bit outdated. So we need to co-create or co-design that sort of model. So it's really about the vet or the vet nurse initiating a conversation within the consultation room or out on farm, gathering the information, having a discussion, exploring with the client what their concerns are, what their expectations are, gathering all that information together, thinking about a treatment plan, making sure that the client is able to give the tablets or the farmer is able to give the injections of whatever the medicine is, making sure that they understand what they have to do and why they have to do it. So again, it's that co-creation. So they understand they're very much part of that plan, and then closing the consultation with any follow-up after that. So really it is about co-design, co-creation, just to make sure that they understand what their role is and they feel very empowered to be able to deliver that when you're not around. Yes, so I mentioned this earlier, contextualised care. And it's really what we've been doing for a long time, but it probably just hasn't had a label. And that contextualised care is really what I touched on just now, is by having that co-creation, co-design with the client, understanding what their circumstances are, understanding what their financial circumstances are, so that you can tailor the options for treatment to that client. It's not a one-size-fits-all, absolutely. So again, the client feels listened to, understood, they're able to deliver the treatment plan that you've designed together because it is within their financial scope, it is within their physical abilities. So for example, if you have a pensioner with really bad arthritis, you can't be asking them to give tablets to a cat 3 times a day. So it's really holistic. Contextualised is just really thinking and understanding, and you only understand because you've asked those questions, going back to compassionate communication, really taking time to listen and understand the client that you're talking to so that you can deliver contextualised care. Yes, absolutely. So one of the models, and I picked this one particularly because I like the name, it's really something that has stuck in my mind, so hopefully it might stick in the minds of others as well. And I won't go into it in huge detail, and there are other models that might be useful, but I think really all of these models are a variation on a theme. So the one I'm going to mention is again from the NHS, it's Manchester University Foundation Trust, and it's called Sage and Time. So it did stick in my mind, but SAGE is about listening. So it's about what's the setting, it's about assimilating the information and gathering information and then being empathetic. So that's all about the listening. SAGE is about the listening. And time is about the responding. So that's T, talk, H is for helping, Y is about the you, M is about me, and E is about ending the conversation. And it's just, again, as I said, as a variation on a theme, just a different way of looking at the various steps within a compassionate communication conversation. So make sure that they're all covered. Some models might work better for some, other frameworks. But in terms of the stage and time, they've done a lot of work on this. And the research from this study showed that using the stage and time model, it really helps patients to understand more clearly what's happening. It helps them to comply better. And it helps them to cope better with the situation as well. So it's really, again, that co-creation, co-design, so that it's better for everybody. It's better for patient outcomes. It's better for the medical profession because they're imparting their knowledge and experience to the benefit of their patient. So very much a model that's used by the medics, but something we should possibly consider for the veterinary profession as well. Yeah, so specifically for the veterinary professions, there are several courses on the RCVS Academy that are, so for example, on complaints and compassionate communication. So I would absolutely refer people to have a look at those, again, just to kind of really deepen their understanding of what compassionate communication is and how to deal with these challenging situations. So looking at some of the resources that we've highlighted in the slides, what you can bring to a compassionate communication conversation is commitment. So a real commitment that you want to engage, you want to understand the person that you're communicating with, really understand what's motivating them, what are their challenges, what are their experiences, just to make sure you've got that, you can do that co-creation. You want to bring your skills to the conversation as well. So you want to impart the knowledge that you have built up over years, all your theory, all of that knowledge and expertise, to be able to communicate that properly with an individual. So again, looking at various models, see which one works best for you, and then being able to sort of send that person off with the best knowledge that you've imparted for the best outcomes for their animal, be that a companion animal or a farm animal. There are a number of different resources, and they're excellent resources. So I would refer you to the slide, which details the many courses that you can access. They're free. And so, for example, I would say that to deliver compassionate communication and compassionate care, we need to start with ourselves first. So self-compassion is really important, and I'm actually doing the self-compassionate care course that's on the Vet Mind Matters site at the moment. So little videos that you watch over the course of a week. And if you think back again, just circling back to my earlier comment, that compassionate care just makes such a difference to the owners and the patient's experience of that situation, of that consultation and of that care. So really important we look after ourselves so that we can look after our owners, but also critically look after the animals that we treat.